I'm Tolly the Midwife of tollythemidwife.com. I run private childbirth preparation classes in Nigeria because I believe when women are informed and empowered, they have a positive birthing experience. So today I'm going to share a few tips for pregnant women and nursing mothers on how to stay healthy during COVID. So it's really important that you still attend your antenatal appointments. During your antenatal appointments, that's when your obstetrician or your midwife checks you to make sure that you are fine and your baby's fine. So your appointments might be slightly spaced out, but it's important that you speak to your maternity unit or your hospital and find out what the procedure is now during COVID. But you can't really afford to miss antenatal appointments. Are you monitoring your baby's movements? So most babies start to move around 18 weeks. It might feel like flutters, but it's quite obvious from around 20 weeks. It's really important that you get to understand your baby's routine, so what's normal for your baby. Lots of reasons why babies may not move as much as they normally do. Do not ignore this. It's really important that you take action. If you're concerned about your baby's movements, call your maternity unit and explain to them what's happening, and they'll advise you on what to do. But your baby must be moving every single day. For low-risk women, you might go into labour during this whole COVID. It's important if you are low risk, and that means no medical complications, no diabetes, no small for gestational age babies or anything like that. You can do the early part of labour, also known as the latent phase, at home. So when your contractions are irregular and not that strong, walk around the house, take paracetamol, have a shower, ask your birthing partners to give you a massage, anything to get you through so you get to active labour. The longer you stay at home, you reduce the chances of you needing any medical intervention, and then also your hospital stay is so much shorter. Being on lockdown, doing social distancing is not an excuse to not mobilise. It's really important you stay nice and active. So you can walk around in your house. If you've got steps, fantastic, walk up and down the steps. You can walk around in your compound, but you need to stay active in pregnancy and also after you've had the baby. While you're keeping active, don't forget to drink at least 2.5 litres of water. It sounds a lot, it's not. It's about 8 glasses of water every single day. It's really important that you follow the rules set by the World Health Organization. So remember to wash your hands regularly. You must cough or sneeze into your elbow, and if you do into a tissue, discard the tissue and wash your hands straight away. Don't forget to maintain your social distancing. So ideally, the further you can stay away from people, the better. But social distancing doesn't mean like a total disconnection from the world. Stay in contact with your loved ones by FaceTiming, WhatsApp call, video calls, calling regularly so you don't feel totally disconnected from the world. So while we are preaching stay at home, work from home, social distancing, you may be on lockdown as well. It's really important that you know when you have to go to the hospital. So you need to call your maternity unit and go to the hospital if you experience any of the following. A persistent headache that doesn't go away with paracetamol, or once you've drank enough water and you've had a good rest and your headache is still there. Flashing lights, shapes and stars in your eyes, or anything that we call visual disturbances, please do not ignore it. If your baby's not moving as much as usual, if the pattern has changed, if you're unsure, if your waters break before 37 weeks, I would suggest packing your bags and taking a hospital note and going straight to the hospital. So if your waters break and it's anything other than clear, you need any vaginal bleeding, please don't ignore it. Don't wait till the next day. And if you have any general concerns or you're genuinely feeling unwell or you feel something's not quite right, trust those instincts and go straight to the hospital. Call your hospital and they'll advise you on what to do. My nursing mothers. So from the little evidence we have, we know that it's safe for you to breastfeed your babies, but you must take all the necessary precautions before you breastfeed your baby. So please note, this is not a time for visitors. I know everyone wants to celebrate this new baby with you, but ideally we should reduce the risks of anyone bringing COVID into your home, infecting you or your baby to an absolute minimal. So no visitors, except for your essential postpartum support group. So that could be your mother, your nanny. So it's not a time to panic or to be scared. I feel the major takeaway from everything we've discussed today is washing your hands regularly with soap and water for at least 20 seconds. If you found the tips useful, don't forget to like, comment, share and repost. Thank you.